Assalamu alaikum everyone. Bismillah ar-Rahman ar-Rahim. My name is Dr. Mohsin Malik. I've been part of the BIMA COVID response group and also work with the Muslim Council Wales. So I'm just going to talk a bit about what we've been doing from the burials, ghusls and financial support perspective, how we've arrived at the decision basically of what our final position has been. So we looked at practice in other countries on what they've been doing for funerals and pre-burial handling, what the medical authorities around the world in the UK have said, what the opinions of the scholars have been, and finally, where we come in. So very, very briefly, just some examples of what people have done in other countries. In Jerusalem, obviously the Jewish faith, they decided not to do any washing at all there. In America, in Washington, similarly, no washing. In Ireland as well, direct burial. In the Jewish community in America as well, no washing. Interestingly, interesting bit, they also call it tahara. Similar in Italy, and even in Muslim countries like Iran, they stopped doing the normal Muslim burial rituals and we're doing direct burial. So coming to us then in the UK and around the world, what do the medical authorities actually say? There's a lot of text in there, so I'm not actually going to be speaking about everything here. I've just it's a lot of medical jargon. I'll just put a lot of it in so people can use it at the point of reference. I've just summarized all the main points. I'm just going to be going through it very briefly, basically, because it's not really the main purpose of today. Public Health England acknowledge that the risk of infection, but importantly, they say it's a low risk. And they suggest that anyone in contact with the deceased should wear PPE and is deemed safe if doing so, as a virus degrades after death. Risk of transmission is due to aerosol production after death. So they're talking mainly about the hospital period, immediately after death. And they also believe that any fluid spillage is not a risk, as they believe the virus rapidly degrades after death. Royal College of Pathology, similarly, they also deem it safe if you're wearing PPE. I've just put the red box there because we're not dealing with them autopsy part. They say also it's safe provided we're wearing PPE, and they talk about wearing a disposable gown, gloves, surgical mask, and a visor, as shown in this picture. So this is the type of clothing we should be wearing when we are doing any washing with COVID disease patients. World Health Organization, they state until now there's been no evidence of transmission of COVID from the deceased, but they still advise anyone interacting with the body to wear PPE. They stress the importance to deep cleaning after use and having a well-ventilated facility, and they go further and say anyone ill or above a certain age should not have any interaction with the body at all. And furthermore, they advise that anyone handling the coffin is only required to wear gloves, not the rest of the PPE. And finally, ECDC, the European Centre for Disease and Prevention Control, they also say that there's been no transmission of COVID from the deceased. They advise anyone not wearing PPE, they should minimize any direct contact, and they consider sufficient PPE just to be gloves and a long sleeve water-resistant gown. They don't mention anything about eye protection or mask. For standing handling of the deceased, they consider it to be quite low risk, but if there is any chance of any splashing, they do recommend visors and eye protection then. So that's in summary 4 different medical authorities. A lot of similar views. Basically, they all say that it's safe to deal with the deceased provided wearing PPE, and they differ with what they consider to be correct PPE. So what have our scholars said? There have been 3 main opinions. One has been that ghusl is not necessary as they consider shaheed because of the way they've died. Another group of scholars have said that ghusl should not be done because it's not safe. And finally, another group of scholars said it should be done as long as it's medically safe. So where does that leave the community? Basically, you got the scholars who seem to be saying opposing things. So what did we do at BIMA? We consulted the scholars ourselves. We liaised with the National Burial Council, Public Health England, and also specialists in different fields, including infectious disease. And we believe we come to some kind of like happy middle ground, which tries to appease everyone. And we don't think basically the scholarly views are actually that contradictory. The issue mainly seems to be about safety. If it is deemed safe, can ghusl occur? So we produced a short Q&A and a flow chart to follow to determine the course of action. So this is a Q&A that we've done. If the risk is low, what is the problem? We wanted to highlight that really that there is still some risk. Some people are saying that there shouldn't be any handling at all. Some people are saying there's not an issue, that people are being overly worried, but there is a risk. People are saying it's low risk as if it's nothing, but precautions still need to be taken. Where on the body does the risk of COVID come from? We mentioned the different areas that possibly that infection can be caused from and why caution is needed. And how can the risk be minimized? And we suggest avoiding any use of any shower or extinguisher spray, which is often used, and also no vigorous handling of the body. What makes ghusl safe? We suggest a well-ventilated room, and that's cleaned properly and thoroughly in between use. What is appropriate PPE? We're following the Public Health England advice that surgical masks and visors are needed during ghusl and protecting the body, as well as the gown and gloves. And we also state that full PPE is not needed for the burial aspect. Gloves are sufficient for when you're actually handling the coffin after any washing is done. What training is needed? We think it's very important to know how to don and doff the PPE correctly, because if it's not done properly, you can actually get infected when you're taking off the PPE. There are videos online, and I think we are trying to get to produce our own on how to do it properly. It is online. Ideally, it should be taught face-to-face by a PPE trainer. It's a very good question. People asking, the worldwide shortage of PPE. Shouldn't we be prioritizing for the NHS? It's a very good question. I guess it's more of an ethical question and above our remit. We believe local authorities should be contacted to check availability of PPE in the area. In my own area in Cardiff, the local authority have said there's enough for the local hospitals and for the faith councils as well. So obviously, if the pandemic worsens and there is a significant obvious shortage, then this question does need to be looked at, no doubt. Who are high risks? Anyone over the age of 70 and anyone with any chronic conditions, i.e. people who are normally eligible for the flu vaccine. Chronic heart or chest problems, diabetes, etc. The full list is on the NHS website. If the above is not possible, then local ulama should be consulted on alternative methods. And we created this flowchart. It's very easy to follow. If you suspect COVID, then is that appropriate and ventilated facility? Yes. Is there PPE available? Yes. Are there adequate number of ghusl performers who are fit and healthy? Are they trained? Yes. And do they know how to don and doff PPE? Yes. Then go ahead, perform ghusl. If any of that is not able to be done, then an alternative method should be sought, and you should consult your local scholars, and they can give a better answer for the context of your locality. We stress that ghusl is a normative obligation, and it should be performed where possible. But the Deen, we have mercy in our Deen. We have alternative opinions where it's not deemed safe. We should follow the other opinions there.
Assalamu alaikum. May I just step in for a second on that flow chart? Just something to make aware of. I hope you don't mind me interrupting, Mohsin.
Go ahead.
So some people ask a genuine question, and it makes a lot of sense. They say, look, we don't know who has COVID in the community. Someone could have died of a heart attack, but how did we know that they did not already have the disease? They just didn't have any symptoms. So should we not treat all patients as if they have COVID? And others will say, no, this is extreme. If someone is in the community, they did not have any symptoms whatsoever, they died of a known cause that was definitely not COVID, heart attack, stroke, car accident, nauzubillah, then we shouldn't treat them as if they have COVID. Both of them have their pros and cons, and you can argue both ways. You cannot say that this one is 100% right and this one is 100% wrong for any of them. That's why we want to create a system. We really want the Muslim community at all levels to get out of the habit of 100% of zero or 0% gain, because then everyone has to be a winner and loser. We have to create some flexibility in the system to allow for context and for people's opinions. So if you follow the opinion that everyone should be treated as COVID, whether they die of COVID or don't, because they could be asymptomatic, and if you think that this is what is comfortable for you and your community, then you will go, okay, treat as suspected COVID, and you'll go down this pathway. If you feel that that's an extreme position and that you would treat some people as COVID and some people as not, so you will make the differentiation on if they had respiratory symptoms, if they had some symptoms of COVID but they didn't get tested, then you will go down this pathway. There has to be flexibility, inshallah. If you don't have flexibility, then you're going to break.
Thank you, Wajid. Okay. So, are there any other options? There is the option that this needs to be explored. Can the hospital do ghusl? This is occurring in some parts of the country. That you can get the hospital, either the nursing staff or the mortuary staff or whoever, to do the wash before they discharge the body to the burial team. That kind of opinion is accepted by the Hanafi madhab. That's why I'm mentioning it, because the intention is important and non-Muslim can do the wash. It is something that's happening in certain parts of the country. For example, in Manchester, and even in Cardiff, we have had early discussions with the local hospitals, and we have a meeting this week. But it does look quite promising. In fact, they went as far as saying, "Oh, do you want some kind of prayer to be recited? Give us a recording. We'll recite the prayer while we're doing the wash," which obviously isn't necessary, but they were quite accommodating. It's something worth exploring. I'm not saying definitely go down this route, because we have to think about other things. Are we taking nurses away from dealing with living patients? Is this something that is actually manageable? But it is perhaps worth exploring by discussing with your local health teams. I'm just going to touch on this, not really BIMA related, but because it's touching on funerals, I thought I'd just briefly mention it. The government has provided grants for people who are struggling financially. Especially it's relevant if below we have several deaths in the same family, and there is help available. If you go on that website, give.uk/funeral payments, and they don't pay for the full burial, but significant contribution related to the person and living in the UK. If you still don't meet any of that criteria and you still need financial support, then alhamdulillah, National Zakat Foundation have advised to contact them for further assistance. Finally, something a bit even less related, there is going to be a webinar, I believe on Tuesday, 8 o'clock, about Nightingale mosques. Basically in Bolton, they've been working with the NHS, and they created a twin 2-bed unit in the mosque, open to all, basically to relieve pressure on the hospitals. They also focus mainly on providing respite care for patients closer to the families in a dignified manner, end-of-life care, mainly staffed by local GPs, pharmacists, support workers. If you want to find out more about it, and maybe perhaps set up something similar in your area, then please attend the webinar, and there'll be a presentation by Dr. Jiva and an extended Q&A open to all. Please let everyone know. Any questions, please feel free to ask.
Thank you so much. I have a few questions, and lots of people have been submitting questions through the chat facility. Thank you so much. And thank you to Dr. Wajid for answering some of these questions in the chat facility. So please be sure to have a read of that. You mentioned that handling a COVID-19 deceased body is low risk. Could you maybe elaborate as to what low risk means?
Okay, Jazakallah khairan for that. This is relative to a case that is high risk. So where does the risk come from a body? The risk comes from anything that produces aerosols, so anything that, like a cough or passing wind or burping, that kind of stuff, anything that produces a spray, that is an aerosol generating procedure or event, and that causes high risk. The risk also comes from feces, from the back passage area. If there's any feces over there, that can cause risk. The risk can come from a spray, water spray. So if you're spraying water from a shower, a stinger spray, and there's a little bit, even fine amount coming off, that causes a risk. The risk can also come from on the surface of the body, whether there has been some COVID there, particularly from areas like the hair. It's a fomite, which is an area which bugs like to be trapped in, that kind of area. So those are the areas that you can get risk. But we know that the infection can live on even on an inert surface like cardboard or a piece of wood. It can live on that for a few hours at least even up to a day or more. So that's why there is still some risk. That's why there is some risk. It's not no risk. There is still some risk. However, in a standard ghusl procedure where you're simply pouring the water gently, you're avoiding splashes, you are avoiding sprays of water, you are taking extra care on the mouth area and the back passage area, and you're not excessively handling the body, then the risk is minimized to quite a degree. I have to be careful here, brothers and sisters. Different countries, different places have made different assessments. Some say, no, it's all high risk, straight bury, no ghusl. Others say, no, there's no, it's low risk, go ahead as normal. This is a rapidly evolving area, and there's differences of opinion, which is why we need to allow for differences of opinion. But we can't say that there's no risk, but certainly the risk is low, and we can make it even lower if we follow some of those clear guidelines, inshallah.
So does wearing personal protective equipment protect from all of those risks, from most of those risks? And are there any other risks to those either performing the ghusl or attending the funeral?
The biggest risk, is not from the dead body. The biggest risk is from the other person next to you who's washing the dead body, right? Because that's a living person. And that's a person who could be coughing in an enclosed room like many of the ghusl facilities are. That's the biggest risk. If they have the disease and they don't know it and they're asymptomatic, that's the biggest risk. So it's the body is there as a risk, but this is the biggest risk. The personal protective equipment that we have, there's a big debate about what is acceptable, right? What level is needed and by whom, and what is available, and what's ethical to use on funerals, and what's needed on the front line. There's a big debate about this, and on expiry dates, and which ones work and which ones don't. It's a huge debate. But please don't think that I'm wearing this, therefore I can do whatever I want. I can use the spray. I can, we can have 10 people in a ghusl room because I'm wearing it, I'm immune. You're not. That's not the case. This is all a question of reducing risk rather than eliminating risk. You wear the personal protective equipment. You make sure that you put it on properly. You make sure your arms are covered. You wear your gloves, your visor. You cover your beard. You do all this not to eliminate risk. You do it to reduce it. That's it.
And the UK government updated their PPE guidelines on Thursday. Does your guidance cover this, and is there a need to wear protective eyewear?
If you don't wear protective eyewear, then just go wearing a t-shirt and shorts. Then there's no point. The eye is, there's no, the virus does not discriminate. It will go into the eye and you'll catch it that way. So if you don't have eyewear, if you don't have a shield, a visor shield, then don't bother doing ghusl. You are putting your life in danger. By doing that, you're doing the wrong thing.
And we've had a number of questions about those handling the janazah or volunteers performing ghusl. Could you specifically outline who should not be handling the janazah of someone that has passed away of COVID, and maybe how these volunteers can be vetted, or who should be vetting them?
So this is important. The people who definitely should not be doing ghusl on someone who may or may not have COVID are anyone in the at-risk group. That 70, officially, this is 70 and above in this country. In other countries, it's 65. In another country, it's 60. But let's go by this country's rules, 70 and above. Anyone with a major health condition or on an immunosuppressive drug. And you can find the full list of the high-risk group on the NHS website. Now, a lot of people think that if they're not in the high-risk group, they're okay, inshallah. They'll get it and there's no problems. This is not the case. I have close friends who are in their 30s, healthy, no medical problems whatsoever. They're doctors and they're in intensive care right now. This is, the young people, a 13-year-old died. Yesterday, a 5-year-old died. We know that the majority of people who die are elderly and they have other diseases, but they're not the only ones. So everyone needs to be careful. But certainly if you're in that at-risk group, 70 or over, or any age with a medical condition that's listed on the NHS website as high risk, then you should not even be outside your house. Forget about doing ghusl. What are you doing outside your door? Like, this is not the time to play games.
Thank you. How do we best balance the health of people doing ghusl and the rights of the deceased?
That is not a question for a doctor. That's a question for a scholar or ethicist. I appreciate that. Our job, we have to be careful about what our job is, to tell you what is high risk and low risk, and how you can protect yourself. But it's for our scholars and ethicists to tell us the balancing between those rights. And of course, in every community and every scholar, they have to make their own decisions up. People are scared, and it's something, this is justifiable to be scared about. And it's understandable that they're scared, but we also have a right on, the deceased have a right on us. The families have a right on us. I'll give you an example about visiting your loved ones in intensive care. I think there is something brewing right now where, some people say, look, medically the best thing is no visitors at all in intensive care, not one, because it lets the medical team do their job without any interruption, and there's less chance of any transmission of the virus. Medically, that's the best answer. But morally, is it right that a child, 13-year-old, dies by himself, not one family member by his side? Is buried by himself, no family member there? I don't know the specifics of that case, but that isn't the only case. Is it right, like what they're doing in Italy? In Italy, you get one WhatsApp photo when your loved one dies. You're not allowed to come. You get one WhatsApp photo when they die and one WhatsApp photo of the coffin, and that's it. So there needs to be some kind of balance, but who makes that balance? It's not up to the doctors.
Thank you. Could you explain the situation around body bags and whether they still need to be used, and whether that's still the government guidance?
Body bags need to be used. You don't in this country, you don't carry a body out, like without covering or something. So a bag is there to protect the public. It's necessary to use them. There was a bit of a shortage, but I just want to make one thing clear. No one will get cremated because they didn't have enough body bags. Like this, that's not a thing. That doesn't happen. The government or the NHS has no right to say, we didn't have enough body bags, we're going to start cremating people. That's inaccurate. Now, it may be that some nurse or some doctor or someone somewhere said this because they're using their own logic, but that's inaccurate. If there was a situation where there were, na'udhu billah, hundreds of thousands of people dying, and they literally had nowhere, then those questions become realistic about mass graves and cremation, all those things. But this is not the situation that we're in. We're in the game of tens of thousands of people. Inshallah, may Allah make it less. So body bags is something that's necessary, but no one is going to get cremated against their wishes. They've already promised that according to the government rules.
Thank you so much. And I know that there was a message that went around earlier this week that went viral regarding cremation and body bags, and I think Brother Hassan will touch on that slightly later when he discusses fake news. I have two last questions for you, please, Dr. Wajid. In your medical opinion, how many people or how should we hold janazah prayers? Should this be kept to a bare minimum? Is there a specific number of people? How can they be performed whilst maintaining safety and social distancing measures?
I think this is one of those areas, it's like so much is, where it's a cross between the scholarly and medical side. From the medical side, we have, again, it's whatever number you have there, they can spread the virus between them. So you can even see amongst the governments, in Germany, they don't allow groups of more than 2 people. In Austria, no groups of more than 5 people. In France, no groups of more than 50 people. So every country, it's like, this isn't science. You're making up the rules. Everyone's making a rule at a number that they're arbitrarily comfortable with. We can't say that this is a number that you'll be safe with this number, and anything above this number is unsafe. Any number of people that are there, even if there are two people, if one of them is got the disease, they can give it to the other person. So all we can say is that whatever number that is there, it should be a minimum. And I think the funeral directors and the National Burial Council are the ones who will know what they can manage. It should be a minimum, absolute minimum. Like, this is not the time for the best friend to take a space from the relative. This is an absolute minimum. Number two, that they should be social distancing while they're there, 2 meters minimum apart. When they're there, they should stand apart. And we saw the sad images from the funeral of the young 13-year-old Ismail, that people they were praying the janazah prayer not next to each other. They were praying quite distance apart from each other. So to keep them apart. If you're sick, please don't go. Because you can spread it to others. I think the one thing I would like to tell everyone is that please don't make one funeral the cause for others. And actually, we have Sheikh Yunus with us, who will probably be able to answer these much better than myself. I don't know if we're able to give him make him a panelist.
Yes.
Actually.
Assalamu alaikum wa
rahmatullah.
So I think in terms, I just mentioned about the body bags. That viral video that went around, I think there was a few things that was exaggerated. Yes, there are shortages of body bags in the hospitals. We are finding that, but that does not mean that a body cannot be collected without a body bag, because the body's already been moved from the ward to the mortuary without a body bag. So why would the hospital then stop a funeral director from collecting a body without a body bag when it's already been moved by the hospital staff from the ward to the mortuary? That's number one. So that's one. And the second one, in terms of funerals, absolutely. I think we've had some cases where lots of people are turning up. We saw the news in Birmingham where over 100 mourners turned up. I think this is irresponsible. I think we have to understand how this disease is spreading, and social distancing, extremely important. Gardens of Peace have now, and Eternal Gardens have now started to only allow 5 people for the funeral. And again, it's going to be arbitrary. I think we just need to be responsible. We just need to be sensible. And it is going to affect individuals in the future. So sometimes we might have to do a live stream rather than doing a recording, because I personally feel uncomfortable doing a recording of a funeral. And that's my own personal opinion. I think even if we can comfort the family to do a live stream of the Janazah Salah, that might be a better option than lots of people turning up.
Thank you so much. From either Brother Yunus or either of the doctors from BIMA, did any of you have any sort of concluding thoughts?
Just what Dr. Wajid and the rest have mentioned. I think the ghusl element, the safety is extremely important. This cannot be any other type of ghusl that we normally do. And I think BIMA did a fantastic job in the chart that they have taken out in terms of looking at the risks. And if we can't mitigate the risks, then you have to go for the other option. But if you can mitigate risks, and I think what we need to do as a community is create hubs in different towns, find the best facilities, either one facility or 2 facilities in one town, and use them as the hub so that we're not putting others at risk. So if the best ventilated facility, the best facility, which is big, which has got the right materials, disinfectants, etc., the PPE, and then we will hopefully be able to manage the ghusl. But if we can't, then we have to go for the other option. Jazakallah.
Thank you so much. We'll now hear from Sister Zora Khaku from the Muslim Youth Helpline.